Interconnected Gardens is a garden network proposal to improve brain health in aging population, designed and researched by Ashley Paresh and Zihan.
This project proposal has been designed and thought through around the basis of a persona, Barb. Barb is an 83-year-old woman who cared for her sick husband for 13 years before this death 9 months ago. The two of them lived in a rural retirement community in central Michigan. Barb has now found herself to be in declining mental and physical health due to her putting her health on the side for her husband in his last years. She finds walking to the mailbox has become a struggle, and her only daily exercise is going to the grocery store. Barb finds herself exhausted by doing basic physical activities, often stating, "I can't," and "I'm too old." This transitions into her inability to interact with friends and family, as she feels she is a burden or that people simply do not want to interact with her due to limitations. This overall leaves a feeling of helplessness, anxiousness, loneliness, and mental dependency. After Barb's husband passed, purpose has been absent from Barb's life. On a typical day, Barb wakes up early to drink coffee and watch the news, followed by some breakfast and chores, and possibly a trip outside to the grocery or trash yard. The rest of the day could be spent relaxing on the couch, as Barb is a frequent streaming service watcher and has limited social interactions.
Familiarity and social engagement are important factors as aging seniors go through dramatic life changes. Engaging in community activities and group environments allows seniors to connect with familiar activities and meet new people. Gardening and horticulture therapy are great for seniors as it allows that familiar sense if they garden in their yards. It brings the community together socially, and it strengthens skills mentally, physically, and cognitively. Upon Barb's introduction to Ann Arbor, it's crucial that she becomes familiar and stays close to key infrastructures essential for her life. Since Barb is not comfortable with driving through traffic, having activities within easy reach is vital. Barb will be living in a senior community named Brookhaven Apartments. This primarily independent living complex offers a range of luxury amenities, including various program activities and exercise options. These facilities could assist Barb in starting to interact more with others on a smaller scale. Ann Arbor is a wonderful place for Barb to move to, as she will find many engagement opportunities at various senior centers and education center. Activities such as Tai Chi, cognitive games, and stimulating conversations are designed to stimulate her mind and social skills.
Thinking about ways to propose design that would benefit Barb, we want to think about traffic, comfortability on walks such as seating, and designing programs that will motivate Barb to leave her personal residence as well as feel included. Our group is proposing to meet these design challenges through horticulture therapy, which will ultimately improve her mental and physical health.
In terms of proposing a new program in infrastructure space for Barb, Barb used to reach out to college students at the local campuses with her late husband to aid in landscape and exterior house maintenance. Considering Ann Arbor is partially a college town, creating this familiar environment together in a common hobby is something that would create a welcoming environment. The startup of the proposal would consist of a small-scale garden design maintained by local students involving the Ann Arbor and Pittsfield Township community. The first phase of the proposal will be the first intervention between the hospice, preschool, and sports complex. Using Barb, our persona, she may advertise the space through her apartment complex friends or friends she meet at the community centers. The surrounding organization may begin to add programs involving coming to the garden. The second phase of the proposal may start to add more spaces and scale within the garden and even farm scale. Here we would see more programs and structures such as meditation, yoga, exercise, group therapy, book club, therapeutic gardens, garden games, intergenerational learning, and many more possibilities. The third phase of the proposal may start to connect many of the existing infrastructure mentioned before and new infrastructures. Pocket Park may pop up close to other surrounding infrastructures and possibly by bus stops and transportation facilities. The linkage between areas will be interconnected through the border network or community garden spaces that spread across the neighborhood. User might use one location or multiple locations, and possibly greenhouse spaces will allow for the program to continue through the cold months of Ann Arbor.